Always wash and dry your hands thoroughly before inserting your contact lenses. Before inserting your contact lenses, remove the lens from the storage case and make sure it is not damaged, particularly checking the edges for any signs of damage. Check too that there are no deposits on the lens. Rinse your lenses with sterile, saline or multi-purpose solution before you insert them. Using your preferred hand, hold your thumb, index and middle finger together to form a tripod and place the lens on top of this tripod. Fill the lens with preservative-free saline, amidose or AMO lens plus saline and lean forward and look down at the floor. Sometimes it is helpful to place a mirror flat on the counter to look into as you insert the lens. Pull your upper lid up using the middle finger of the other hand. Maintain a firm hold of the upper eyelid to prevent blinking. Pull down the lower lid using your ring finger of the hand holding the lens. Gently place the lens on your eye while firmly holding both eyelids in position. Try to keep both eyes open without blinking. It is very important not to push the lens too forcefully onto the eye. Once the lens is on your eye, check the lens on your eye using a mirror to ensure there are no bubbles under the lens. If there are bubbles present, you will need to remove it and reinsert it. If you wear a lens in the other eye, do the same for the second lens. Alternatively, you can place the lens on a DMV device instead of a finger tripod as shown here. The lens can then be inserted in the same way as if it was on a finger tripod. Using your preferred hand, rest the mini scleral lens on two fingers, the index finger and the middle finger, pressed closely together. Fill the lens with preservative-free saline, amidose or AMO lens plus saline. Lean forward and look down at the floor. Sometimes it is helpful to place a mirror flat on the counter to look into as you insert the lens. Use your other hand to hold open the eyelids by pulling down the lower lid with your thumb and pulling up the top lid with your forefinger. Gently place the lens onto your eye while firmly holding both lids. Try to keep both eyes open without blinking. It is very important not to push the lens too forcefully onto the eye. Once the lens is on your eye, check the lens using a mirror to ensure there are no air bubbles under the lens. If there are bubbles present, you will need to remove the lens and reinsert it. If you wear a lens in the other eye, repeat for the second lens. Throw away the solution from your case, rinse it with saline solution and leave it upside down on a clean surface to air dry. Removal with a suction holder. Draw the upper eyelid up with the fingers of your non-preferred hand. Pull the lower lid down with the middle finger of your preferred hand and place the suction holder on the lower third of the mini scleral contact lens. It is imperative that the suction holder is not placed directly onto the surface of the eye. Pull gently away from the eye to remove the lens. Remove the suction holder from the lens by gently sliding it off the lens. Never attach the suction holder to the center of the lens and pull. Alternative removal method. Looking slightly down, draw the upper eyelid up from where your eyelashes begin with your index finger. Hold the eyelid directly against the eyeball so that the eyelid is directly above the upper rim of the lens. Press the edge of your upper eyelid against the eyeball beneath the contact lens to release the suction. Then tighten the lid by drawing your finger towards the temple to eject the lens from your eye. Catch it with your other hand, or do this over a table covered with a towel to prevent the lens from falling onto the floor. Place the lens into the palm of your hand and put 2 or 3 drops of the cleaning solution, Ote Cleaner, onto the lens. Rub the lens all over gently but firmly with the little finger of your other hand for approximately 30 seconds. After rubbing the lens, it is essential to rinse it with saline solution or multi-purpose solution. Fill the storage case with fresh multi-purpose solution and place the lens into the correct side of the storage case. If you wear a lens in the other eye, do the same for the second lens.